Today, we all here to discuss the topic of how will virtual care continue to evolve. Um, Today, we are here with our guest today. Let's start to introduce our guest, Dr. Heba, who's the founder and the CEO of Reverb Medical Group, focused on chronic disease patient. Dr. Mark Melanari is the Vice President and the Medical Director of Insular Healthcare, a leading HMO in the Philippines. And also Dr. Margan is a CEO and the co-founder of Cairo Company based on Switzerland, offering a digital mindfulness and relaxation solution for busy professionals. Thank you all. So, also, last but not least, Dr. Maki Sugimoto, hopefully I said it right, is a surgeon and innovator. He's the founder of Hollow Eye Company that's interest in remote imaging and communication service using VR, AI, and mixed reality, metaverse. Thank you. Thank you for being here. So, COVID pandemic changed the way we are seeing healthcare. Thanks to COVID, which is, we consider it as a incredible magnifying glass to our challenges in virtual care. Today, we are here to discuss the topic or the very important question on how will virtual care continue to evolve and to be sure that digitally enabled. Telecommunication technology are being used to shape healthcare industry with the use of telehealth, telemedical, and visual care that's really push the boundaries to traditional healthcare. So let's start without further ado with our first question. Can you please, Dr. Mark, answer the question on where we are here now in terms of visual care?
So, good morning. Virtual healthcare is defined as providing medical services remotely through the use of technology or a different platform other than going face-to-face with between the patient and the doctor. The supposedly virtual healthcare could address the whole spectrum of healthcare for all the patients that a doctor has. The healthcare system has advanced further, and with the help, ironically, with the help of the pandemic, the use of virtual healthcare has advanced further with all our patients currently. In the Philippines, I could talk about the Philippines. In the Philippines, the most widely used form of virtual healthcare is teleconsultation. Prior to the pandemic, it has not been used widely in the Philippines. However, when COVID-19 pandemic struck, that's the time that Filipino patients have learned to talk with their doctors remotely through different applications, different platforms. And I think that's a good indication of how our healthcare system has been moving there in the Philippines. But there are also other types of virtual healthcare present worldwide. There are remote patient monitors. I know you have heard about those. You are able to monitor your blood sugar, your blood pressure, and your even have your electrocardiogram right when you are doing teleconsultation with your cardiologist. So there are also automated assistants and chatbots. They are called virtual nurses. They are able to do primary screening. They are able to do triaging of patients, whether you need to see this specialist, whether you need to go to an emergency room to address your needs. And there are also remote case managers, systems that are able to address chronic and debilitating patients. And lastly, I think it's a very important form of virtual healthcare available right now are self-help portals as well. This is initiated by the patient, him or herself. They are able to address the whole spectrum of illnesses from physical up to the mental health aspect of the patient. And I think we are moving faster than we have expected because of the COVID-19 pandemic. And I'm truly optimistic with the help of great minds like these people around me. Virtual healthcare would be moving towards the goal of improving healthcare to all our patients.
Yeah, we have seen a lot of examples with the really startups and companies that start to use the virtual care, whether it's before the pandemic or it start harder during the pandemic. Morgan, can you give an example of your company and how it's doing?
Absolutely. Thank you, Dr. Amani. So it's really interesting that I think when we're talking about virtual care, it's also very important to talk about the mental well-being and the mental health aspect of virtual care. And that's where basically we have been trying to focus on, because especially because of COVID, we have seen that right now we are experiencing a burnout crisis in the world. Especially in the corporate sectors, but also in other sectors as well. People are more stressed than ever. They're leaving their companies at a higher rate than ever before. And a lot of times this stress is unchecked, and it leads to a lot of, it has a domino effect on the other aspects of your life. So, and this is also, in addition to that, we have a time crisis, meaning that we have less and less time. Our lives are becoming extremely complicated. There is more pressure, and basically with the increase in the number of notifications we are receiving on our phones, on different gadgets, that's not going anywhere. And if we don't have tools or techniques to help us feel grounded and find balance within ourselves, we as individuals are going to suffer, and companies as well. So what we're seeing is that the way we see the future is that both on an individual and on a company level, there will be more investments on mental well-being of their employees.
Wonderful, wonderful. So yeah, you talk about your company and how it's work. It's based on Switzerland?
Yes, we're based in Switzerland, but we have all of our offerings are online nowadays. You can have access to your relaxation techniques all in your pocket or on your phone, just one click away, basically. And there will be more and more, I think, solutions like that in the future.
Wonderful. How about you, Heba? Can you give us an example based on your company?
Well, I founded a company called Revive Medical Group, which is completely focused on patients with chronic complex diseases. And my focus was a bit different, that it was the other way around. So rather than thinking about virtual care per se, we were thinking about creating a clinical system that would allow for the co-production of health and well-being for chronic patients between their doctors and themselves. And that would also redefine how the health professionals operate within that system. And most importantly, create like a visible journey for the patient where they have like goal-oriented follow-ups and goal-oriented treatment plans and a comprehensive treatment plan. And while we were just completely focused on that clinical setup, we found that it's really impossible to deliver this kind of a comprehensive system, which we call the 7-step system, without the help of digital care and virtual care and technology in general. So clinical care really did inspire us to look at what the options are in terms of virtual care. So this is what we're focused on.
Wonderful.
Yeah.
How about you, Maki?
Hello, I'm a surgeon from Tokyo, Japan. And I'm basically in Japan. After COVID-19, the remote situation is the basic situation in the clinical setting, and we need to remote and have a distance from the patient to doctors or medical student for practice or some clinical application. So we need to get more data of the patient immediately after examination. But I'm very interested in the medical imaging, not only the text or the conversation. I'm very focused on the medical imaging. 2D monitor is a little bit different to understand the spatial understanding and spatial awareness of the patient's situation, like cancer extension or the difficult anatomy or some changes by the diseases, each patient individual diseases. So we need to know much about these 3D or spatial understanding data. So we are now very focused on the development of the virtual reality in the medical situation. Then in Japan, the IT company are very focused on these metaverse area to promote the healthcare.
Thank you so much. So we are now pushing into technology and using the technology deeply, whether it's visual reality or mixed reality, or even sending an email. So we use our telephones nowadays to ask doctors to take a prescription and to have a recommendation to our health. So I think the last 2 years we jumped before we are ready. And that's really let us know about the challenges and what we need to work on in terms of changes and updating. So Dr. Heba, can you please give us what's your current challenges that you see nowadays in healthcare?
Again, I'm going to bore you with talking about chronic diseases because it's my main line of work and focus, but also it really is the biggest burden on healthcare worldwide, especially when we're talking about outpatient population where they are working active day-to-day, part of the community, but they do have a lot of challenges. So I think virtual care has advanced a lot over the past couple of years. And as Dr. Mark mentioned, there are very different forms, whether it's telemedicine or trackers or et cetera. I think what would really help with the chronic disease burden and would make a difference in outcome and the health of population and community is if virtual care would be seen as much more than a delivery method. So rather than just seeing it as a telehealth or just a tracker which is mainly targeting patients, if it would be more comprehensive, if it would be introduce more AI to perhaps coach patients throughout their journey as well, I think that would make a huge difference. And the current challenges now, from my perspective, is that when you look at products out there that should support that journey, you'd either find them customer focused in terms of like trackers that are like trendy and cool and engaging, but wouldn't on itself just like, you know, treat a chronic patient or a patient in general. Or you would find like EMR and virtual care technology platforms that are targeting doctors, and so they have doctors in mind when they're creating their products, when it really should be a partnership between both, and they should have doctors and patients, just because the end result product that you get when you are customizing for doctors' needs in the clinical setting is quite different from when you're customizing for a patient. So just to sum it up, I think a comprehensive integrative partnership between clinicians and technology developers in creating something that would be sort of like a big platform or umbrella to help us combat chronic diseases would be really great.
Yeah, I really agree with you. Actually, we either like talk from like medical perspective or from tech perspective. Actually, we really need to sit together and see this like problems in a way that's it's different, and it's different than before. Like when we talk about healthcare or digital healthcare, like maybe before pandemic, most of the doctors will say like it's not going to work, but they change, and we need to be agree that technology need to be part of this change. Yes, thank you so much. Can anyone add? Yes.
Yeah, I think another challenge that we would be encountering in terms of virtual healthcare would be adoption to the technology that you guys would be introducing to the patients. I can speak for the Philippines. We have been having a hard time pushing for the use of teleconsultations just because, first and foremost, it would need a good internet connection. That's a big problem in the country. And with that, driving adoption would be very much a challenge for us to push people to use the platforms or the different virtual healthcare apps that we have or we introduce to the patients. And coming from the insurance side of things, we are slowly adapting as well to giving coverage to this virtual healthcare services being introduced, and hopefully in the future there will be more insurance companies like ours who would be giving coverage as well to these opportunities for patients.
You are right. We all have phones with us, but do we have internet all the time? So the infrastructure is one of the challenges, at least in some countries. Yes, you are right.
And just to add
you.
to that, from my perspective, I come from the corporate sector, especially from the financial industry. And when it comes to convincing senior management that, yes, your teams need virtual care when it comes to their mental well-being, for example, yes, they're much more open than before, than pre-COVID. However, they still want to see if there's immediate profit in it or not. And that's, I think, something that will take some time to sort of for them to see the value and the fact that it's not really a choice anymore, and it has to be done fast. And if not, they're going to be suffering as well. So I think that's one challenge.
I totally agree with you. I think governments need to be part of this in order to be a rule in use. Maki, can you add anything, doctor?
Yeah, the accessibility is very important, I think. And the accessibility for a doctor it should be needed in the clinical institution, but the accessibility for the patient and the healthy people is very important, I think. And in Japan, all healthy people are covered from the national medical insurance. And recently, the many companies in Japan are now promoting the remote medicine and the telemedicine using like an Apple Watch or some wearable devices for detecting the vital sign or the medical checking in their own home and in their city. So we need to collect the data, not only the simple data, but also we can calculate the data collection for what is for the data useful from the healthy people's data. And the sample is that the high diabetes, only the sugar, blood sugar data is not so important, but the time differences or the time course is very important. And not only the sugar data, the blood sugar data, but also the medication or the daily timing or some treatment and exercise or something, and the lifestyle. And we need to collect all of these data and then not gather the data, not only gathering the data, but also we can analyze each data for each individual patient. So I think the data should, after getting the data, we should give these data to individual patient or individual healthy people. And the database is very important. Now, many companies are now building some cloud system of the healthcare data, and the healthy people can share these data each other. The family is the very important category for sharing the data between the patient and healthy people and healthy people, right? And we need to promote the telemedicine using the huge data, not only the big data, but also the useful data.
Yes, data is a very important part of visual healthcare. Having this data being collected in the right way, save it in the right way securely, also have it open source for everyone to be using it at the right time. You address a very important point, Dr. Maki.
But now we are promoting by our company Horizon to gather the medical imaging data like X-ray, CT CAT scan, and MRI. And healthy people doesn't understand the CT data or MRI data. We are now reconstruct the 3D anatomy from each patient data in the cloud, and we can provide these 3D data to individual patient and to each healthy people. But not only the DICOM data, the layer data, but also the like a computer graphics polygon data is very important. Where the data amount is very light, and they can watch their anatomy in the smartphone. And with a Wanderer goggle, paper Wanderer goggle, they can have a virtual reality experience with their own smartphone, like bring your own device, BYOD, right?
Yeah, you're right. I believe that healthcare is not anymore a doctor-patient relationships. We add more actors into this, how can I say it? It's like we need to add data analysis people, we need AI people, we need to work all together to have a very high standard healthcare systems or applications. Let's go to our third question. What are the opportunity? We just talk about challenges, and with all these challenges, it comes a lot of opportunities. Dr. Morgan, can you explain more in terms of opportunities?
Absolutely. So the way we see it, basically, we see a lot of opportunities on three angles: on prevention, on intervention, and customization. And what I mean by that is that on the prevention side, especially after COVID, we have seen that there's so much more awareness around, mental well-being is what I understand, but I think generally around our health. And what we see that if before it used to be that people would get to a point where they would have to be hospitalized because of burnout, because of anxiety, and because of too much stress, especially at work, now people are taking more action faster and before it gets to that point. And I think that's where one opportunity that we are trying to leverage on in the future. And on the intervention side, we see that any solutions that come to the market, they have to be respecting people's time, because time has become more of a commodity, meaning that we have less of it. We are just getting busier and busier. So if I came to you today and said, let's go on a retreat for a whole month to Bali, everyone would probably like the idea, but no one would have the time for it. It could be that before it used to be much more possible or plausible, whereas now I can't even think about that for the next few years because we just have so much going on. There's just from left, right, and center, we have pressure that's increasing. We have expectations from work, from family, you name it. So I think in the future, any opportunities that we will have on the virtual care side would have to respect people's time. So therefore, they would have to be very quick, they have to be digitized, and they have to be, effective right away and accessible. And on the customization angle, basically people will expect more personalized solutions. And that's where we see an opportunity in the virtual care because people want to, they don't want to, there's no one solution that fits all. There's no blanket solution that would address people's concerns. Everyone is different in 1,000,001 ways. So I think customization and personalization of solutions is very key, and that's going to continue to be the case more in the future.
Thank you so much. Can anyone add on?
I think going back to what you just said, that there is much more awareness now on an individual level, not just towards healthcare organization. And people in general and individuals are more open to take control and ownership of their own health. And I think there's an opportunity there for technology developers that rather than targeting primarily physicians and healthcare organization as their primary target for a new product or a new development, that they could also start looking at individuals in the population or the community for such a service. That's one thing I think could be an opportunity. The other thing is there is a lack of physicians and doctors worldwide, and this gap is increasing all the time. And there's a lot of pressure on doctors, and speaking of like burnout and mental health, I think the introduction of AI and the introduction of reintroduction of virtual care as not just a delivery method, but also an intervention or possible coaching or check-ins, it could take a lot of the work from doctors. And it would just help with decreasing the pressure on doctors and providing patients with, or individuals with, the health support that they need, even in general day-to-day coaching.
Wonderful. How about you, Dr. Maki? Can you add any opportunities?
No, I completely agree with your opinion. And the AI, as you mentioned, is very important, I think. And not only for AI for doctors, but also the AI for patients and AI for the healthy people should be needed to gather the data in the near future. And in Japan, the remote situation is the standard, and we need to contact to not only directly to the patient, but also in the web or virtual space, right? AI is very promising in the virtual reality space to gather not only the verbal data, but also the movement of the patient and the surgical procedure or some non-verbal communication itself. We need to gather these data for AI to analyze the future new database.
Wonderful. Thank you so much. So there is a lot of opportunity when it comes to virtual healthcare. That include using the shift technology, whether AI, visual reality, mixed reality, or the use of also the visual assistant. We can also get you advantage of the sensors that we have, whether it's our smartwatch or our even phones, to gather information that can be useful, whether it's intentionally that been taken from the patient or taken by using the sensors that we can take advantage of. Whether also it is preventions or detection of disease, or whether it's quality of life. There is a very, very big opportunities nowadays that we can take advantage of. That's open up the question on what is the future that we see in the near future of the healthcare and visual healthcare. So, Miki, can you please give us some information regarding that?
Yeah, this time I would like to talk about the avatar in the metaverse. And a remote situation, we need to contact not only directly, but virtually contact to the patient. But there's no people in the clinical institution. But the avatar can replace the patient itself in the near future, I think. And not only one avatar, but also several avatars in the virtual reality environment. We can have communication virtually at the same time and in the real time. Then we can gather the data of the conversation itself, non-verbal communication, and the movement of the procedure. That's very important. And I'm a surgeon. That we need to teach our new procedure and difficult procedure for individual patient, like a huge, big tumor for the cancer situation, cancer surgery. But it is very difficult to teach our movement of the hand and the fingers for the young student. But using the avatar, we can calculate the location and the movement in 3D. And we can review and show to other students and doctors wearing the goggles and the tracing the movement itself with the virtual hand movement of the hand and the real hand of them, and we can catch the virtual environment with the virtual hand or physical of hand at the same time. That's a tracing training. And in Japan, our company are now promoting the training system using the avatar and tracing the movement itself. And many veteran surgeons, the professor in the university, are now collaborating with our company to capture their skills and the very good procedures for the difficult surgery. And now we have the big database with their narration and determination of the treatment for individual patient. That's very important and very valuable data of the treatment itself. So in the near future, we should gather not only the diagnosis data, but the treatment data or treatment experience, and share these data, not only the 2D monitor, but the so-called metaverse space with the movement or the verbal information for individual patient. And we can communicate with them using the avatar from the distant part or different countries, like a borderless medicine, right? So next time we wanted to gather these data all over the world, not only Japan, because we Japanese usually use Japanese, not English. The Japanese doesn't good at speaking English. That's a very important point. That's a very difficult problem, right? But using AI, we can translate the Japanese verbal communication to all over, not only English, but also the all over world, right? And
so language
AI
won't be
needed.
a problem anymore. Yes.
Right.
Yeah, I
Wonderful.
think the future would be everything cuts across, or it eliminates all the boundaries that we have right now. Time, you mentioned that a while ago. Space, distance, language barriers would be out of the question already, because there is an opportunity out there, I guess.
Wonderful. Can you add on the future of the healthcare?
Well, no, they covered it very well. I think it's really interesting. Just one point on the avatars and metaverse. I have recently come across a lot of new technology where you can actually create your meditation, for example, and then go to the metaverse to practice it, and you create your own visual around it, and I find that very interesting, just as a quick
Wonderful.
example. Yeah.
How about you, Dr. Heba?
I think it's all the great panelists here pretty much covered the opportunities and the challenges and the future of how it would look like. I don't think I can top that really, but I definitely, I'm very impressed with everything that's been said, and I completely agree with it, and I really hope that we all work together to make people healthier and happier and make things just more accessible to everyone.
Yeah, virtual care is really a promising field, and we see a lot of changes, and we will see a lot. Digital twin is a hot topic nowadays, and we add another aspect to the health where we can either improving the quality of life or improving it or adding AI parts in order to recommend things to the patient so that prevent them to be ill in the first place. Let's open the talk with our, yes, we have questions. A lot of questions, actually. Yes.
Many people.
Thank you very much for really helping us to think more for the future. The question is for Dr. Heba and Dr. Mark. I think my interest is, how is the virtual care affecting the quality of care as well as the patient's compliance? I think this is going to be an issue all the time. And so I just want to know your experience right now. And I believe that we have more to develop. But yeah, it would be good to know now so that we can consider. Thank you.
I think that's an excellent point. I think one of the main reasons why I'm a huge fan of virtual care is the impact we've seen on patients' compliance, because you could do the best for patients, you can have the best treatment strategy and plan, but you're always faced with non-compliance, which is a big problem in healthcare. So when virtual care is applied in all of different aspects, whether you're using trackers, whether you're using automated messages, post follow-ups to confirm to the patient what's next, or even giving them access to see the review notes written by the doctor. And the fact that, in our practice, what we do is we plan the entire patient journey for the whole year with very clear goals, and we divide them into milestones that need to be reached on a monthly basis. So that kind of engagement and ownership that is only powered really by virtual care, because you can't do it just with manpower. Not only did it just enhance compliance, it did enhance compliance, it did motivate patients to self-educate and read more, and having a purpose or a specific goal is very inspiring if the patient can actually see it to them to get to that. So you do end up also with a practice that is very much focused on treatment outcome rather than number of visits or number of medications prescribed.
Thank you, Doctor.
Well, I totally agree with Dr. Heba about putting value to compliance and ensuring that patient compliance is at a high when using virtual healthcare. But on the flip side of things, I think what's going to be affected would be the human touch that doctors provide to their patients. I was schooled in a Catholic university, Catholic medical school in the Philippines, and we value compassion and warmth during face-to-face consultations. And I think that's what would need to be looked into moving towards virtual healthcare. But I totally agree that compliance is well measured when using virtual healthcare.
If I can just add to that, because that's a really important point. So the one thing that we've always, in my organization, been like absolutely rigid about avoiding is to change healthcare into 100% virtual. I think human touch is still important. Body language and communication is 90% of communication. So at least we have like a couple of visits that are like scheduled for patients when they start. And then building that important rapport, which is a big fundamental part in medicine. And then the follow-ups, this is where virtual care comes in, AI, trackers, all of these supportive tools that would just make the outcome much easier to be achieved.
Wonderful. Yes.
Hello, hi, I'm Sumant. I represent Zybian Digital here. First of all, let me thank all the panelists for your wonderful insights. If you look at the industry, how it emerges, industry is going at Industry 4.0 era, right? Because of the regulations that are associated with healthcare and pharma, we always follow the Industry 4.0. So pharma, they are claiming like the manufacturing, everything as they are also in 4.0 era. Healthcare also is going there. So my basic observation here is during the pandemic, if you see, I know all the panelists had covered the points like how the doctor and patient interactions are converted into virtual. That is very good. But if you see the effects of pandemic, the patients having diabetes who are actually, the entire practices, they have the habit of going to clinics, and the entire treatment structure, everything is also associated to clinics until then. But Doctor, you just mentioned about the augmented reality, how the trainings are happening by using the augmented reality, all of that. Now, my question here is, how far are we like to see an augmented reality based operations? Because if you see during the pandemic, there are so many patients who are supposed to get operated, their surgeries and all, they got postponed, and so many had lost their lives. So how far are we with the augmented reality to do the surgeries online?
In our institution, not only all the patients should be needed the augmented reality, but we select the patient such as difficult determination for the treatment and a huge big tumor for like a liver cancer or liver transplantation. But you know, imagine the GPS for car navigation, and you need to drive the car navigation now, but 30 years ago, you are not using the car navigation GPS, right? But it's very useful, and we need this navigation, right? But in the near future, maybe it's the normal. But if you put the car navigation data to your window during the driving, it's not useful, or it's very diminish for the actual space, the real world, right? So it depends on the surgeon or the procedure itself. Sometimes it's very useful for navigating the surgical procedure or determination of the disease and guiding the insertion of some medical devices. But very easy case, or for the veteran surgery, it's not always needed for using the augmented reality, but it's just information. The more information gave us more knowledge, and I think the most important thing is the sharing the knowledge of each medical staffs, right? The doctors. And I determine some procedure, but other doctors can determine other answers, right? We need to share and communicate and make the better answer in the near future using the database?
That's not an easy question, actually. We are almost there, I believe, but it's not just a research who can decide whether we're going to use it or not. We are in the loop, so we need some regulations, some rules that approving this research. I believe we all researchers and know that universities, labs are like full of promising projects, but this project need to be approved to be seen in reality and industry. Thank you.
Right.
Yes.
Yeah, sorry, Simon Grange,
I
orthopedics.
think we almost out of time. Do we have? Okay.
Simon Grange, orthopedic surgery. So just following up on that, 25 years ago, the Computer-Assisted Orthopedic Surgery Conference, we were discussing exactly the same thing. We were having problems with registration. The European Space Agency had been doing work with us on how to train the neurosurgeons, etc., to deal with the technologies we had. So 20 years ago, we got to the point we'd implemented some of these. Then we got up to 15 years ago, and we've actually got in a few teaching centers. So by 10 years ago, we've got to the point that we've got certain areas, such as Da Vinci robotics, maybe for urology, maybe certain areas like around the liver, which are of value. Also, we've probably got 5%, maybe 10% of orthopedics where we're using navigation, and I'd say on some of the complex revision cases, it's actually of value. But at the same time, from the commercial side, people are saying, well, actually, yeah, we can do that for the knee because there's a good market for it. You only do 1/10 the number of shoulder replacements, so it's not worth us developing the software for that. So we again have restrictions. So to support my surgical colleague from Japan, I think the key thing is the public perception, because of the marketing, is that robotics is central, that we're going to have augmented reality, it's going to be, an obvious extension of the metaverse. In reality, as a surgeon, if I'm training another surgeon, I'm very happy to have as much information as possible. I also want them to gain that insight that comes from having that extra information, so it becomes intuitive within them. Because the best operation is the one that you do best, and the best place to have the surgical skills is in the head of the person actually doing it. I think we have a responsibility that this information is made available through audit, so we have registries, and that can basically ensure maintenance of standards. But I would want to not let people believe that we are going to cure the problems of waiting lists, of maintaining high standards and everything else just by throwing technology at a problem. Ultimately, surgery is still a very human specialty, I'm afraid. So that's just my comment. Thank you.
Yeah, thank you for your point. Actually, I think, do you want to add on that? I'll take this. So I think COVID is an example that let us all change our mind. One of the problem is that it's based on our expectations, our beliefs, and our traditional way of thinking. We need to change the way we think so that we accept all new technologies or new solutions. How many of you here that decide not to take COVID vaccination because they believe it's not good for themselves? So that's an example. So it's a choice whether you choose it or not, but we need to have it there to be seen from all of us, and then we can add on, we can change, because if it stay in labs, it will stay in labs, and when no one will see it. So I think that's the things that we here, for example, want to promote, that let's do it. Let's do virtual healthcare. Let's work on it. Let's see the problems and work on answer it and solve it. We cannot have a solution that work today and work 100% in high quality. We will accept and like 50% that work, and then we work on improving. If we stay and we said, well, we need to think, we will not move any farther. That's my add-on. Thank you.
Yeah. One question here. First of all, great enriching discussion. The question that I have whenever I think about virtual care delivery, the point comes to my mind is, how about the personal connection between a patient and a doctor, right? Whenever somebody is going to log into a virtual VCD platform, likely odds are that he would be assigned to a new physician. Of course, there will be data, so prior history would be captured. I get that. But the point I'm trying to make is, how about, what are your guys' thought that at my first visit on VCD, Dr. X consulted me, and now I'm talking to a Dr. Y and Dr. Z, vice versa, over time. So that's like the care continuity from the patient side. The second thing is also how we are ensuring the suitability of a physician for a patient. So for example, some physicians are very much expert in dealing with the elderly population, complex cases, and some people are very, very well versed with dealing with the millennials. So how are we ensuring the appropriability or suitability of while we assign a physician to a particular caller or a visitor on a VCD platform?
Do you get the question, or?
So the question is, patient-provider personal connection, as on VCD platform when they come, on first visit, it might be Dr. X who get assigned because he was available. On second visit, maybe a week later, it could be a Dr. Y. On third visit, another 2 weeks or 3 weeks later, it is Dr. Z. Of course, data is there, so not debating about the data piece or the information piece, but as a patient, I would feel more comfortable when a same physician is seeing me, consulting me, because there happens to be an emotional connect. That's a part A. The part B is, how are we ensuring the suitability of a physician when somebody is coming to a VCD platform? Because different doctors might be expert or more suitable for a certain segment or sub-cohort of the population. So how are we ensuring suitability? Are we taking or thinking on those lines or not?
So I believe you address one of the challenges of the data. Who's owning the data? Is it going to be belong to the hospital? Is it going to be belong to the patient? Or
Sorry to interrupt, not about the data. I'm saying data is there. Dr. X, Dr. Y, Dr. Z gets to see the same patient history. So I'm not talking about the treatment continuity per se. I'm talking about the care continuity, as in if I'm the patient, I would like the same doctor to be consulting me again and again, because you happen to develop the relationship of trust with your doctor. But in VCD platform, every time it could be a random doctor getting assigned based on the roster, based on the availability.
it's based on how you program it. So if you wanted to go back to the same prefer doctor, it's based on how you program your application. So I don't know. I think it's specific kind of problem that you talk about. I don't know if someone want to add on it.
Are you, I think I kind of understand what you're trying to say. Are you trying to pull out the point that with many system and care provision, having a patient seen by more than one doctor would actually affect their treatment outcome and the doctor-patient relationship? Is that what? Yeah, well, there is an element of truth to that, and that was one of the challenges we had when we were creating our 7-step system, where we wanted to be more system-focused rather than doctor-focused, just because of so many reasons. One of it is the pressure that that I just mentioned earlier on doctors, and we also wanted to, as much as the patient-physician relationship is fantastic, but also we wanted to kind of like blunt a bit the element of dependency on the doctor 100% and encourage the collaborative and ownership of the patient's health and taking matter into his own or her hand. But that was definitely something that we've noticed, and so what we ended up doing, as you explained, the data and all the consultation notes and the treatment plans is available there for the medical team, but we did noticed that when we assign the patient to like maximum 2 physicians who are doing the continuity of care, the outcome is so much better, the engagement is so much better. So we did readjust our system according to that. When we were trying to just like assign patient to whatever doctor is on call or on schedule, it wasn't, the results wasn't as good as we wanted them. So this is a very, very good point, and it would take a lot of like strategy review in terms of how you would like to set up practice that way that would sort of like have specific one patient assigned to do doctors and not more than that.
Thank
I
you,
hope that
Doctor.
answered your question.
No, that definitely does, like, you know, and as you rightly said, that we have to figure out the system thinking, right? Because even the patient has a preference. Some patients want to the point, doctor talking to the point, straight to the point, no left and right. On the contrary, some people, like, you know, especially like my grandparents, they would love to hear the doctor, like, tell the story to the doctor that, hey, these are all symptoms, take my time. I want doctor also to consult me in time-taking fashion. So there is certainly a patient preference or personal choice matter as well. So as long as we are baking that into the system thinking, yes, I agree with you.
Yeah, I'd like to add to this just like quickly, a health discovery call before any commitment and entering into the journey of treatment with the medical team or the doctor does help a lot, because it gives the patient the opportunity to check rapport and to check if there is like the doctor is the right fit or not, because that's an important element that cannot be replaced by anything virtual or AI really.
Great, thank you so much. Thank you. Can we take one more question? Sorry, I think we don't have much of the time.
Yeah, I know there's a gentleman who wants to ask a question, but we really do not have time. But you can write the question down and definitely approach them during networking sessions.
Thank you.
Thank you to our panelists for sharing their thoughts and research with us. And of course, Dr. Amina for moderating the conversation.